there, everybody, and welcome to another edition of the Ask Dr. Jack Show. I am Dr. Jack Belitz, chiropractor in Omaha.
Hello, I'm Aaliyah, Dr. Jack's assistant.
And together we make up the Ask Dr. Jack Show 2.0. All right, what are we doing today?
So today we're going to talk about joint health. What you should do if you injure a joint, or how to avoid injuring a joint, maybe.
Because that's important for this time of year. You know, people are very active.
Well, it's important all year long.
All year long, exactly. So, okay, so let's talk a little bit about joints. Okay, so a joint is basically where two bones come together. And with that structure, almost always we have ligaments that hold the bones together. We have tendons from the muscles that actually the muscles will create movement of the joint of the bones. And we usually have a joint capsule surrounding the joint, which provides a way to keep all the lubrication, the synovial fluid, in place so that the joint works properly and doesn't get all like stuck.
That fluid is what you hear when you like pop your knuckles and stuff too, isn't it?
There's a lot of debate about that. A lot of times they say there's air escaping from certain things. We don't really know. It's a weirdness. Yeah, but good. Yes, yeah. A lot of people would think that. But we don't really know. Anyway, so here's the thing: is that joints, if you want them to be working well for you, the first thing you want to do if you're going to do some type of activity is maybe take a few seconds and stretch. You know, and if you're beyond the teens, you know, when you're in your teens, you don't necessarily need to stretch as much. Although I do love the way that all these activities are training kids to stretch before their activities these days. Because back when I was playing tennis or whatever, they just said, okay, get out there and go. And you can do that when you're a kid, you know. Not so much when you get a little older, because your body needs that few minutes just to get those muscles and those tendons, you know, stretched and ready to moving and stuff like that. So, very important thing.
It's a good habit to get your kids into.
Yeah. And then, you know, before you start your activity really hard, you want to, you know, work up to a little bit. So if you're going to want to run, maybe jog, you know, the length of a couple of houses and just kind of walk for a few seconds and just, you know, kind of get yourself warmed up a little bit before you actually go and do the activity.
Loosen up.
Loosen up. That's right. Stretching is really good. You don't want to do what we call ballistic stretching, where you're pumping at the end, all right? You want to do nice, long, even stretch all the way to the end till it feels nice and, you know, stretched out, and don't go any farther. Just get a good stretch.
Until you feel the pull,
yeah.
And then hold it for a few seconds. They say you should hold it a little bit longer the older you get.
There you go.
I was always told. But
yeah.
whatever, as long as you're stretching.
Yeah, that's an important thing. So let's talk about what happens if you do hurt yourself. You know, generally speaking, ice is going to be your best friend. And that is because whenever you injure something, your body needs to bring all kinds of good things for the healing process. And it does that through the fluids that happen to accumulate when you have what we call swelling. Now, your body always overdoes it. So that's why if you look on the sidelines of the NFL, you will see a lot of ice. And that's because, you know, they realize that you don't need as much swelling as the body naturally brings in. Most of the time, the pain that you feel from a joint injury is where the joint capsule has become stretched, because a lot of the pain fibers in your joint area are from that joint capsule. And so when that becomes stretched and pulled, like from the increase of swelling, that stretch on that capsule is what causes a lot of the pain that you feel. So bringing ice into that area is going to keep the swelling away, keep the joint from swelling so much, so it'll keep down the pain.
We understand heat is kind of more comfortable and more relieving, but really heat can inflame the problem a little bit more when it's a joint.
It brings more swelling into the joint, and that actually causes more pain. Yes, that is very accurate. So now here's the thing. Heat, what it will do is it'll bring a lot of good things for the muscles if you injured muscles.
But not your joints.
But the amount of pain that it actually produces outweighs the benefits that it gives you. So assess yourself. You know, if you hurt yourself around a joint, you know, put that joint through some range of motion without using your muscles. If that elicits pain, then you have a joint problem. If you have somebody, you know, hold your leg and try to pull it out, and that's like, for instance, it was a knee problem or a finger problem, you pull your finger and have somebody push on, you know, resist it a little bit, you know. If that's what causes the pain, then it's a muscle issue. So you can kind of diagnose yourself. If it's more muscle than it is joint, use your heat. But if it's more joint issue than, or even if there's any joint at all in the problem, you definitely want to use ice. It's your best friend.
And then as far as like pain relievers, you know, we recommend like an arnica.
Yes, arnica is an amazing help for
What's the
strains
other one?
and sprains. Hypericum works very well
That's what I was
too.
thinking of.
Yes. So, you know, there's some really great homeopathics depending on what the deal is. But let's just, you know, I just remembered icing. How you ice is really important too. You don't just throw a bag of ice on and call it good. The ice works really good up until about 15 to 20 minutes because it will push away a lot of the swelling. But if you put your ice bag on the joint more than 20 minutes, the body decides that there's like too much coldness, and so it actually brings more swelling into the area to try to save that tissue so it doesn't freeze. So that will be a problem too. So 15 to 20 minutes is a great little window of time for icing. Also, make sure there's a damp cloth between the ice bag and your skin. Because the ice directly on your skin is going to cause the skin to start to freeze, and the body, again, doesn't want your skin to freeze, so it's going to bring more blood, more swelling to the area, which is not what you want. So if there's a damp cloth there, that moisture, and moisture is the key word, not a dry cloth, moisture, will keep the skin from freezing, but still allow the cold to penetrate very nicely and give you the effects you want deep into the tissues where the joint is.
Well, there you go.
So I hope you really stay safe, especially this time of year with all the activities that are going on. You know, we want to make sure that you know, don't overdo anything. But yeah.
That's it. Please like and share, comment below about
Yes. Stay healthy, Omaha.